Hi guys, I'm Dr. Matt Tonis, and today I'm going to demonstrate for you a couple of the different ways that we take care of patients in our office. So the chiropractic adjustment style and technique that many chiropractors use is very different across the board. In our office we have three very gentle and what I'm going to call as state-of-the-art types of techniques that we use to make spinal correction for patients. So one of the things that patients would say is, well, what is spinal correction? Spinal correction is literally helping to reshape the spine, correcting people's postures so that on things like an old x-ray and a new x-ray, you can actually see a difference. So a chiropractic exam, before we even do an adjustment in our office, always involves multiple objective tools. One of the things we'll often use with patients would be x-rays. Some of the other objective measurements we take is we have a digital range of motion analysis unit that helps to see exactly how the spine is moving in all the different planes of movement. We also use an infrared thermography scan to help see where the nerve system is distressed and the inflammation and temperature levels in the spine are elevated and not doing what they should be doing. So we have multiple tools we use to try to determine exactly where to make the most precise, effective adjustments in patients. That's one of the reasons why patients heal so great when they're in our office, is because we know precisely exactly what we're doing. So to start with, one of the adjusting techniques that we use in our office is called a neuromechanical instrument. So this is an electrically powered instrument that delivers an impulse into the spine, and it does that in a very specific way to help mechanically create movement in the spine where things have become stuck and fixated. And it also helps to reset the proprioceptive system in the body by using a half sine wave stimulus, which is very, very good to help with the nerve system itself. So what will end up happening is there will be an impulse that goes into the spine, much like you could see my finger moving here, and that'll help to direct and move the spine in a way that's very, very precise, comfortable for the patient, gentle, but highly effective in making corrections. One of the other things we'll do is we'll use these sophisticated tables that we have. So these are pneumatic drop tables, which means they're powered by air, and they help to precisely allow us to make changes in patients with specific drop pieces. So you'll hear these table pieces are going to pop up underneath of here. And then if we apply a gentle little force into the patient, those table pieces will drop back down, just like that. They make a little bit of a noise, but they help to move the body in a certain subtle direction, whether that's to improve separation in a joint, whether it's to change the direction of movement. Whatever needs to happen, these precise table pieces allow us to do that very, very well. And then sometimes what you'll also experience would be a very commonly known chiropractic adjustment, which is called a diversified type of adjustment. So that's where we would manually use our hands in a specific direction to help create the proper spinal movement and the release of nerve pressure that's coming inside the spinal cord that's affecting somebody's health in a detrimental way. Oftentimes those nerve pressure can cause pain inside of people, but oftentimes it also affects the way that various parts of the body function, whether that be muscles, whether that be organs. Different types of tension lead to headaches and different kinds of back pain and all sorts of different things. So this is what it might typically look like with a patient if we were to employ those techniques. We'll usually start somewhere down towards the bottom and just see what the core of the body looks like. How's the symmetry from right to left? That's what a leg length check helps to do, is to figure out how that symmetry is doing. We'll oftentimes come in and feel where things feel like they're moving really well, or where there's maybe some restriction and things are stuck and not moving properly. As we come up the spine, we can see different levels of tension that have accumulated in certain spots, often for people who spend a lot of time on technology and computers and sitting with their commutes. Even kids nowadays on their iPods and iPads, creating all kinds of abnormal spinal tension in ways that there should never be. So proper care for the spine would start by a visit-by-visit analysis and correlating those back to some original types of findings that you might see on somebody's x-rays like we have on the screen there. Once we've determined what needs to be done for that particular visit, then we'll usually utilize those three different techniques to be able to make the spinal corrections. cross this ankle over top of that one for me. Uncross your leg now. Okay, let's have you tuck your chin towards your chest. Back to neutral now. Okay, let's see you turn your head to the right side. Good. Off to the left side. Beautiful. And now back to the center. Take a nice big breath in for me. Let that breath go right on out. And just stay nice and relaxed in there. Beautiful. Good job. Okay. And then let's have you turn your face towards the left-hand side for me as well. Just keep that right there. And back to the center now for me. Okay, that's much better. So what we can see is that some of these areas of high tension and stiffness and fixation are moving better. There's better symmetry from right to left and better mobility as well. That's what a very, very average spinal corrective adjustment would look like. Nothing that's scary, nothing that's overly forceful or uncomfortable for the patient. Chiropractic has come such a long ways over the years that patients can be comfortable, techniques can be gentle and suited to each individual to help with their specific conditions as well as their own personal comfort levels. It's so important that a patient feel comfortable and confident when they're being cared for to get the best results they can. Have a great day.